Hello, welcome to the next episode of Am I Going to Die? I'm Dr. Jeff Gallups, Medical Director of the ENT Institute. Co-hosting with me is
Melissa Moritz. Today, and this is the current episode, not the next episode.
Yes, the current episode of Am I Going to Die? So, what's our topic today?
Are we going to die from acid reflux?
Well, that's a little more complicated. I'm glad we have time to delve into that.
Oh, we got some time. But
Yeah.
what we really want to talk about is the fact that today, April is Esophageal Cancer Awareness Month.
Yes.
And esophageal cancer is nothing to be taken lightly.
Right. And
We got some reverb in here.
yeah, we got some people.
This is real. This
in
is
the
raw.
studio,
This is live.
right?
So what we really want to talk about today is that he's got his volume going crazy. We're going to lose our minds.
So esophageal cancer is the topic,
Yes.
and it's the topic because April is Esophageal Cancer Month. Why is this a hot topic, if you will? Well, esophageal cancer has risen 600% over the past 30 years. It's a real problem, and it's within the scope of ear, nose, and throat because we are experts in the esophagus. We're experts in reflux.
Throat.
In the throat,
got
ear,
it
nose, and
now.
throat. So there's a new kind of term that was, I think, coined by Dr. Jamie Kaufman called aerodigestive medicine. And that is the airway and the digestive tract are not separated. So reflux can cause you to get acid into the airway, which can cause you to cough. We see that
just
reflux.
breathing getting acid. I mean, just breathing gets air into the airway.
Well, it does, but right behind the breathing tube is the swallowing tube known as the esophagus. And now we're seeing, for
they
whatever
touch?
reasons. Well, yes, they do, actually. But,
We need one of those dummy
Yeah.
people things.
well, that'd be great. But it's, it's like a straw, a flat straw, versus the breathing tube, which has cartilage, which is always open. So the esophagus is kind of flat, but has muscle in it. When you swallow a amount of food or a liquid, the esophagus squeezes in a measured fashion to push the food into the stomach. Reflux is when it comes back up from the stomach with acid in it in particular and can erode part of the esophagus. And the association between reflux and esophageal cancer is still under investigation, but they finally realized that we know we have reflux because of the symptoms. You have heartburn, substernal, under the chest, burning. You can also have what we call silent reflux. You clear your throat a lot. Reflux can also go into the nasal cavity and make sinusitis worse, or your ability to breathe through your nose even. So there are a lot of symptoms associated in the ear, nose, and throat arena from reflux. But let's keep this simple right now. Esophageal cancer is more prevalent, we think, because of the Western diet. That is, anything that refluxes, the acid causes the symptom, but that is not what we believe causes the cancer. We think what causes the cancer is the action of, you will, bile salts, which is in the duodenum, the first part of the small intestines after the food leaves the stomach. And you then can get bile salts back into the stomach. When you reflux, the acid irritates the lining of the esophagus, especially the lower esophagus, and the bile acid is what causes the mutation in the lining, which causes esophageal cancer. So you can treat the symptoms of reflux with reflux medications, Pepsid, proton pump inhibitors, H2 receptor inhibitors, such as Zantac, which is kind of the first reflux medicine. So, quick little fact.
Please,
Okay,
enlighten
quick
us.
little fact is, who is the person most likely to get esophageal cancer? Those treated for reflux or those not treated from reflux?
Oh, well, I kind of know the answer, I think. Those treated for reflux.
Right, that is correct. Why? Because you can neutralize the acid, but that doesn't mean you're not refluxing. And that reflux still has bile salts in it, and that's what leads to the cancer. So people have the symptoms, they know they're refluxing, you take the antacid, great, they're still refluxing, they just don't have acid there, so you don't feel it. Right?
And they don't go to really get it treated.
And they
just
take it chronically,
right.
and the next thing you know, it's not till later stages of esophageal cancer that you have difficulty swallowing, right? The most common symptom, and could drive the public crazy, so you have to take it in full view or full understanding, but the number one symptom of someone with esophageal cancer is a chronic cough, right? So that's not the only symptom, but other symptoms are late stage. Why? Because most esophageal cancer isn't diagnosed till later stages.
What causes the chronic cough, if that's the first symptom?
It's the reflux. Right? When you sleep, like a bottle of soda, you have air at the top. If you lay it down, the air comes here, and the top of the bottle now is full of soda. That's what happens when you lay down. I mean, what's ever in the stomach is probably going to find its way up into the esophagus. And what normally prevents that? It's a structure called the lower esophageal sphincter, okay?
I like to say sphincter.
Right, so the lower esophageal sphincter, the LES, is what keeps that from happening. And as we age, it tends to not function as normally. And if you have bad enough reflux, it just stops working altogether.
Can you
so
fix
bad
it?
begets bad. Yes, first you treat the reflux symptoms, the acid, with reflux medications. But there are procedures that you can tighten the lower esophageal sphincter.
What kind of doctor tightens the sphincter?
Generally, it's a general surgeon, or sometimes ear, nose, and throat surgeons who are specially trained to do it. In fact, we've done procedures here at the ENT Institute to treat that lower esophageal sphincter through radio frequency that causes it to become tighter. A well-known procedure called a repair of the hiatal hernia, where you wrap the stomach around the lower esophagus, is done generally by general surgeons or people who are specially trained for it. And so there are ways to do it. Now there are devices that can be implanted, sometimes through the mouth while you're asleep, into the area that help tighten the sphincter as well. But that's kind of beyond the scope of what we're talking about.
We went deep, like right from the right from the start.
We did.
Let's dispel some of the myths.
Okay, give me the first
I'm
one.
going to ask you the myths, and you tell me if they're myths or facts,
Okay.
as we always do.
Hope I can.
So, if I have heartburn, it's just an inconvenience that I have to live with. Myth or fact on that one?
Well, no, it's a myth, but it's somewhere in between.
Okay.
We're always going to have reflux, on and off. Okay, it depends on multiple things.
Little kids too, right?
Little kids, especially when they're first born, the lower esophageal sphincter isn't working, certainly in preemies. And so they tend to spit up a lot, not really vomit, they spit up, but they have the potential to suck that down their windpipe and have pneumonias, right? So again, the airway is protected, but it's not working normally. As we age,
they get pneumonia because they sucked down their formula?
Mm-hmm. They can.
I've never heard of that.
Well, it's a little more complicated than that. It's not a common thing. I mean, babies spit up. Okay?
Right.
That's just normal. Adults can have esophageal, or reflux. In fact, we need to define this. GERD, which is gastroesophageal reflux disease, is the name of that. Occasional reflux we can all get. Something happens, we drink too much, we get the acid taste. That's not what I'm talking about. And it burns, and because of the acid in the stomach.
Right.
So yes, it waxes and wanes and becomes more prevalent throughout life.
Got it. So if I have that acidy reflux stuff, if I drink milk, or then there's some people that say to drink milk and mint.
Well, okay, that's a kind of a crazy one. I know, mint, anything that's irritating can actually make your reflux worse. So that's simply put. Milk just neutralizes, but water will do the same. Almost anything that's non-acidic, something that coats the stomach, helps. In fact, there are medications for reflux that just coat the stomach.
Mylanta?
Yep, helps neutralize.
Not Atlanta, Mylanta.
We could say Mylanta.
So let's say I start taking Tums.
Yep.
Tums or Mylanta or Zantac, and I feel cured.
Well, you will. You'll get temporary relief from that, but not long term. But that's how you know. What is great about, if there's anything great about GERD, gastroesophageal reflux or acid reflux, is that when you're having the symptoms, right? As long as you're educated. Now, most people do not get this acid feeling burning. They get the throat clearing,
Right.
chronic cough, nasal congestion, feel like they can't swallow as well, right? Like, I've got something that's stuck here. We call that globus sensation.
I had globus. It was bad. So
Okay.
I had it because of just an event that we were putting on and the stress leading up to it. And then it was actually after all the stress.
Right.
They had
you
this
could get that.
globus. And
Right.
it was like food stuck right here.
And it feels that way, but it's not. It's just the sensation that food's
Oh,
stuck
no.
there.
I tasted it. It was
Right.
disgusting. So let's talk about this one. I'm afraid to ask this myth. No coffee for you.
Not true. I mean, if you drink coffee and you have the symptoms I just described, then you shouldn't drink as much coffee or coffee at all. But no, I mean,
So if I drink like 6 cups of coffee a day and I get older and my sphincter gets looser, am I going to have acid reflux?
there is so much in that answer I want to give. But here's what I would say is that you're going to have reflux from whatever you drink if you drink enough of it, right? If you're sensitive to coffee, it's probably you probably need to stop drinking coffee for other reasons, not from esophageal reflux. But
No. So my water pH. Okay. There's a lot of water, bottled water now, marketing, and this is why I bring it in because I'm a marketing person on this side. Marketing the pH level. So probably because of the prevalence of acid reflux in the world right
probably
now.
so, and it temporarily works,
Okay.
just like Tums or anything else. So if you're going to drink water, drink it. But listen, let's also look at the other side of this. We have to have acid in our stomachs to digest food. Okay, it has a purpose. Right? If we could just keep it in the stomach, it'd be pretty good, and not eroding the stomach, no ulcers, right? As well. But you know that's that. But waters that have a high pH, a basic pH, neutralizes acid. They're on the opposite ends of the pH scale, but they're only temporary relief.
Got it. So there's a lot people can do at home to take care of themselves. But I think,
They can.
what is the PSA here for the public service announcement here for the month of April, being that it's Esophageal Cancer Awareness Month? As a physician,
That's a
what
great
would you
point.
tell the people, and then we'll wrap
Listen,
it up.
if you have been on reflux medication for a long period of time, and that means anywhere from probably 6 weeks, 6 months, or longer, right? And you keep taking them, and you haven't had someone look down in the stomach, then you need to have that done. It's not a screening procedure; it's indicated because if you stop your medication and you have the same symptoms, you need to be observed, and we can do a procedure called a transnasal esophagoscopy at the ENT Institute. It's a tenth of the cost of going to see a GI doctor. I'm not against them, but we're boarded in reflux ourselves. We can look at the esophagus in the office, no anesthesia, no day off of work, and then you go to lunch. Literally, it takes 2-3 minutes to do
Sounds
this.
scary.
Not
Not at all. So I stay awake the
No.
whole time.
you drink a little water, and we take a very thin tube that goes through the nose, down the stomach, takes 2 minutes, we video it, and we can look at it. And what are we looking for? We're looking for signs, obviously, of growths that are abnormal, which could be cancers, but though they're rare, it's still a 600% increase since over the past 30 years. But we're also looking for precancerous lesions known as Barrett's esophagus, and that is that it's not cancer, and about 10% of the people that have chronic reflux have Barrett's patches, which are precancerous. But that's an indicator that you need to treat it, you need to observe it, right? Because esophageal cancer caught early is easily curable. The problem is the esophagus does not have a protective coat around it that keeps any cancer inside, so any cancer that grows in the esophagus can get out and metastasize, go somewhere else very quickly, and that's why esophageal cancers are so deadly. So if you're on chronic medication and you have not had a scope to look down there, yes, you can do it very simply at the ENT Institute. Don't have to go to sleep, come in the office, sit in the chair, come dressed, drive yourself there, drive yourself to lunch right afterward.
And that sounds great. Can you also take a biopsy when you're
Yes.
when you're in there?
We can. We take a small biopsy to see if it's cancer, which is rare. Knock on wood, I've never seen one, but I have seen Barrett's, and we can biopsy for that. with a brush, and we can use genetic testing to determine whether you have a predilection toward a cancer as well.
Great.
The technology is cutting edge.
Right. So we hope that we have dispelled some of the acid reflux myths. There's a lot out there. You can certainly Google and try to, you know, fix your acid reflux or soothe it with over-the-counter, but being that it's Esophageal Cancer Awareness Month and being that it's one of the fastest growing cancers
Absolutely.
out there right now, what's your recommendation to our viewers?
Well, first, if you have incidental reflux, you're not taking a lot of medicines for it, not really concerned. But if you are taking medications and you've been on them chronically, you know, probably, you know, again, like I said, 6 weeks to 6 months or longer, right? Then you need to consult the Ear, Nose, and Throat Institute or your GI doctor. The GI doctors are great. They do that. We just offer a technique that's very simple to do and is not as in any way as expensive as going to a GI doctor, having the complications
Right.
of potential
You're put to
anesthesia.
sleep.
So you need to check with your doctor, either gastroenterologist or ENT doc, because about half of us do this transnasal esophagoscopy. But at the ENT Institute, we train doctors how to do it.
That's
We're
right.
the experts in it.
Right. So if you have questions or reach out to us, we're available. We do this every week. We're going to continue. We love giving you valuable information and then things that you can proactively do for your health. So don't wait. I would put it off, but I would say on this case, with the rise in this cancer, don't wait. The transnasal esophagoscopy is pretty easy in office.
It's
And,
easier to do than it is for you to pronounce it.
yeah, thank you. I stumbled on that one. And affordable. So we're here for you, and we love giving you the information, and we're available if you have questions or you want us to cover and dispel some other healthcare related myths.
All right. So, all right, great segment. Thanks. Okay. See you next week on
Be here.
Am I Going to Die? Have a
Well,
great day.
am I going to die? Wait. Are you going to die from acid reflux?
No, not really, but you will from esophageal cancer.
There you
Wow,
go.
you just like keep this thing going when we should have ended. Okay, we're done. Thank you. Have a great day.